Hi everyone, this is Dr. Jenkins, and here we go again. And this chapter is going to be on the immune system. I'm thinking I'll probably break this down into 2 videos. We'll see how it goes. I don't want to make them too long for each one, so we'll see. But anyway, here we go. So for this chapter, we really could talk for a whole semester. People work all their lives with immunity. So it is very complex and there's so much to know, which means that because we only have one chapter within a course of many in one semester, we really are just going to cover the surface. But the goal here is to give you a nice foundation. I think I've said it before, but just so you understand the basic foundation. And then as you go on through schooling, if you do, you can add more information. But a really solid foundation is a fantastic thing. And just to show you that I mean it, let's just make sure the pen works today. There we go. All right. So this is how we're going to frame our discussion. We are going to be talking about our immune system in a way that an invading pathogen might experience it. So imagine you're walking down the street and there's a little virus particle in the air. I don't mean COVID, I'm trying to stay positive. Or you touch a door handle and there's a little bacteria. We encounter these pathogens, foreign agents, foreign antigens. We encounter them all the time. So when our body first encounters something, we will throw at it our first line of defense. And really, this first line of defense is mostly our skin. If that invading bacteria or virus penetrates through our first line of defense, then our body has a host of things that can be activated next. So we can activate certain white blood cells, NK cells. We can activate specialized proteins for immunity, or we can activate our immune response, which absolutely has some immune properties. But it will happen, it happens all the time, that a certain bacteria or virus may even survive those attempts to kill it, basically. And if something is able to penetrate our first line of defense and our second line of defense, then and only then will we be throwing at it our third line of defense. So this is how we're going to frame this discussion. Okay, so we're going to start with our first line of defense. As I said, really, our first line of defense is our external barriers. Just think about your skin. We talked about this in A&P1. The skin is your body's largest organ. And we do take it for granted, let's just be honest, but it is very good at its job. It has different types of cells. It is water resistant, but not waterproof. And we have all sorts of things going on, and it serves a very important purpose. Our skin, let me change colors here. Let's use blue. Why not? Our skin is a fantastic external barrier. It separates our insides from the outside world. Not only is the skin a physical barrier, but there's also some chemical properties to our skin in being a barrier to protect us against foreign agents. An example of this would be a protective chemical. So for example, our epidermis, in the oil of our epidermis, the sebum, that sebum or oil has a bactericidal property. So not only is the skin a physical barrier, but there's some chemicals in it that can protect us against bacteria. Now let me introduce a couple terms here. Let's first introduce innate. Innate means that these are defenses that we are born with. If I go back here, these first 2 lines of defense are considered innate. We're born with it. It's part of our normal growth. We are born out of the womb with skin, my friends. We very quickly form an immune system of white blood cells, which is going to make up our second line of defense, most of them. So when we say innate, it means that these are things within our body that we are born with, or that we gain over time with maturation, as part of the normal maturation process. And the first line of defense, the skin, of course we're born with that. Another key term here is that our skin and our first line of defense as a whole is non-specific. And what that means is our skin will protect against any foreign agent. It doesn't matter what it is. It doesn't matter if it's bacteria A or virus Z. The skin is the same protector no matter what. What we're going to find is our first two lines of defense. Not only are they innate, we're born with them, or we develop them naturally by the time we finish puberty, but our first and second lines of defense are also non-specific. It's the same defense no matter what is trying to attack us. The opposite is going to be true of our third line of defense, which means that we have to generate specific immunity to a specific pathogen. And that's only true of our third line of defense. But for our skin, first line of defense, it is innate, we're born with it, and it is non-specific. It protects us the same no matter what is trying to invade us. In addition to our skin, we're also going to count mucous membranes as part of our first line of defense. These are going to be linings of certain tracts within our body. Think of the respiratory tract, your airway. Think of the digestive tract, your mouth. Think about the reproductive tract, particularly in women, the vagina, or in women and men, the urethra. So these are indirectly open to the outside world. So it may not be as easy to understand as our skin, because our skin is always open to the exterior world, really. But these are indirectly open. So if I open my mouth, I could have something come into my mouth and go into my digestive tract. So my esophagus is not directly facing the outside world, but through the fact that I can open my mouth, which is open to the exterior world, something could get in through my mouth and then penetrate deeper into my digestive system. And the same thing is true of our respiratory tract and our reproductive tract in different ways for men and women. So all this is to say that the linings of these tracts are specialized to protect us because they're indirectly open to the outside. So here are some examples. And you'll notice, my friends, just to be clear, because I want to be clear, I've put in red, the text in red are the examples that I'd like you to know, right? So an example in terms of the reproductive tract in women is that the lining of the vagina will release some secretions that are very acidic. And that is helpful because that vaginal tract is indirectly open to the outside. So something could just make its way into there. And the fact that the environment of the vagina is acidic, that acidity can in fact help protect us against certain pathogens. In our respiratory membranes, the inner lining of our respiratory membrane has specialized cells called lysosomes. And the only job of those lysosomes is to gobble up foreign agents. In our respiratory tract, we have mucus. I've been sniffling all semester. Not sniffing, like I'm not doing coke or anything. I came out bad. I've been sniffling, all semester because it's wintertime and I have allergies. So this is just more proof of the mucus. And because I'm trying to protect against something, I have even more mucus. But that mucus serves a purpose. It traps foreign particles that I breathe in. And then I can cough them out or, snot them out into a Kleenex. In both of our respiratory and digestive tracts, we have specialized proteins called defensins. And these specialized proteins that are in the lining of our digestive and respiratory tract, their only job is to help gobble up bad things. And all of these things together are perfectly positioned. Our body knows that because these areas are indirectly open to the outside, we need to have a little bit more protection. So, collectively, both our skin and the linings of some of our inner tracts, like digestive and respiratory, collectively, they make up our first line of defense. Okay, dramatic pause. I just took a drink of some water. Now, this first line of defense is fantastic. Our skin is great. These specialized cells that line our tracts are great. But that doesn't mean that things don't get past them. So always, it's going to happen that a bacteria or virus will penetrate through our first line of defense. And that's what I'm saying here, right? Particularly if we get a cut, that's just an open invitation for things to come in. So even normally without a cut, or when we have situations where our skin has been interrupted, things are going to get past our first line of defense. And when they do, we will activate our second line of defense. So here we go. Our second line of defense, just like our first, is innate. Either we're born with it or we produce it naturally as a part of maturation. And these second lines of defense are non-specific. They are all going to defend the same no matter what bacteria or virus might be invading us. Okay, so we're going to include 5 different things. It's kind of like a toolbox, you know? Our immune system, as part of its second line of defense, has 5 different tools it can pull from. And frequently, a lot of these things are activated at the same time, okay? So it's not just that we only activate the phagocytic cells and nothing else. We tend to activate many because that's just another way that we can better protect us. So we're going to cover each one of these, but know that collectively these are all going to be parts of our second line of defense. Okay, number 1 of the 5. Well, folks, we have our general white blood cells. We consider these to be phagocytic cells. So, you remember, I don't have to tell you this. What is our most common white blood cell? Neutrophils. What do they do? Gobble up bad things. So in that way, I'm considering these neutrophils our general white blood cells. They're floating around in our bloodstream. There's some that are stored in the spleen, so we can release more when needed. But they're always there, and no matter what the bacteria or virus is, look at this little bad guy. A little bad guy's floating in the bloodstream. Our neutrophil, Pac-Man or Pac-Woman, is going to gobble it up. And that's what phagocytosis is, cell eating. Just like Pac-Man or Pac-Woman, that neutrophil will come up against a foreign agent, gobble it up, and then break it down and spew out its contents. These neutrophils, we have a lot of them, okay? Because we need them and they're very effective. They're very good at what they do. Our general white blood cell fighters of bad things. And they do their fighting through phagocytosis. They gobble up the bad guys. We also have another category of white blood cells that we didn't talk about, but I'm going to introduce them here. And another type of white blood cell is a macrophage. As the name suggests, macro, these are bigger. So sometimes we need a supersized fighter. So we have these larger macrophages. They're technically derived from monocytes, which we did talk about, but they also do phagocytosis. You'll notice one of the differences. The neutrophils, they do most of their gobbling up of bad guys or bad gals in the blood. So the neutrophils are floating around in the blood, gobbling up bad things. these macrophages, not only are they a little bit bigger, so they can handle bigger foreign pathogens, but these macrophages tend to enter our tissues. And that's where they do the killing, not in the bloodstream, but these macrophages, they get right in that tissue and they will help to kill the bad things. It is the same technique, however. So phagocytosis, cell eating. All right, cool. So as part of our second line of defense, we have these generalized white blood cells. It's like a generic white blood cell response. Neutrophils and macrophages. And what do? They, if and when they come up against a bad guy, they gobble it up through phagocytosis. Look at this macrophage. It's pretty cool. So we can see that the macrophage is big, the purple little thing, and then it has these specialized extensions that are sticky. So here we have some bacteria that just got too close to the macrophage and they stuck to the little tendrils. And what's going to happen is that macrophage is going to bring those bacteria inside the macrophage to break it down. And then we say, bye-bye, bacteria. All right, I'm going to talk just briefly about phagocytosis. Typically, we call this cell eating because that's what the cell does. And these squares, they were arrows, but I guess my little program here on the iPad doesn't like to put arrows. They just do rectangles. But please, I'd like you to have a general idea. So if we imagine this whole cell to your right, the whole purple thing is a macrophage. It's kind of like this, right? Big purple cell. This could be a macrophage or it could be a neutrophil because they do the same, they perform a similar function. But we have a big purple general white blood cell. And that white blood cell is going to come up against, there's going to be some little bad guys. So there might be some bacteria floating around. And what these general white blood cells do is they come up right to the bacteria and then they just envelope them in. Excuse me. We may remember a certain type of active transport, certain type of movement that requires energy where a cell envelopes something and brings it in. It's called endocytosis. Well, here's an example of that. These white blood cells come really close to the bacteria, and then the cell membrane of that white blood cell literally surrounds the bacteria. It adheres to the bacteria. Notice I put in red over here what the terms I'd like you to know. So the white blood cell surrounds the bacteria, causing the bacteria to adhere to the white blood cell. Now the white blood cell knows that it has it, right? So it's going to then form a vesicle around the adhered bacteria. Here it's called a pseudopod. We can call it a vesicle. And that's how we bring those bacteria into the white blood cell. We're going to take those bad guys to the lysosome. Hey, look at all this A&P1 review. We talked about endocytosis. Now I'm talking about a part of the cell, an organelle that kills bad things. Lysosome. So of course, these white blood cells are going to have many, many lysosomes. So once we bring in the bacteria, the white blood cell will send the bacteria to the lysosome. The lysosome breaks it down, and then the white blood cell spits out the contents. If you're really on top of things and you see this little question down here, it's not going to be on the test, but another organelle within a cell that can help do this is the peroxisome. But the lysosome is the primary one. So as we go through each form of defense, so here we are in the second line of defense, and I'm talking about these generalized white blood cells. I'd like you to know what the defense is I'm talking about, but also what is its mode of killing. So when we talk about generalized white blood cells, which include neutrophils and macrophages, their mode of killing the bad guys is phagocytosis. All right. Let's see. Okay. I will mention this now. We're going to be discussing this more later in this chapter, and I can already see that I'm talking too much. So we will break this chapter up into 2 videos. Well, one of the things that our immune system has to be able to do is our immune system has to be able to determine what a normal cell is for our body versus what an abnormal thing is. You know, I keep using these terms interchangeably, like a pathogen, or it could be a foreign antigen. You know, whatever we're calling them, or whatever they may be, just in a general sense. I mean, our body, our body knows what is normal for it. Kind of like at your house or your apartment. You have visitors, and some of them, you know. Your friend Bobby. Hey, Bobby. Hey, Jane. Your house, you know what's normal. On the other hand, it's just as important to be able to identify what is not normal. So if there's someone that comes to your house who looks a little creepy and is not someone you know, well, you're going to be more on alarm. And our body has to be able to do the same thing. For example, you know, we talked about red blood cells. And we said that, and I'm just going to draw because we have our red blood cells, and some of us have antigens on those red blood cells. So maybe, and actually my personal blood type is A positive, so I have the A antigens on my red blood cell's surface. Well, isn't it important that my body knows that those A antigens are normal for me? Yes. Because I wouldn't want my body to attack what's normal for me. So one of the ways, and we're going to talk about other ways later in this chapter, one of the ways that our body is able to recognize what's foreign is, in particular, a foreign agent, a bacteria or virus, has what we call a carbon signature. The way that it's molecularly designed forms kind of like a fingerprint in a human or a carbon signature. And unfortunately, bacteria, for example, you know, these bacteria and viruses, they evolve. We know this, right? These bacteria evolve, they're smart. And one of the things that bacteria have evolved to do is to hide its carbon signature. And that can make it more difficult for our immune system to identify that bacteria is foreign. So one way that our immune system is able to identify something as foreign is that our immune system can sometimes put a coating over a pathogen called an opsonin. And that coating is what allows the body to determine whether this is a normal or non-normal things. So when our white blood cell, this big thing is our white blood cell, sometimes when our white blood cell surrounds the bad thing, or what we think is a bad thing, brings it in, we're able to determine whether or not it really is a bad thing because of that coating. So, I know I went off on a tangent there because it's really cool. But for this slide, just know that it's important for the body to be able to determine what's normal from what's not normal. One way that we can do this is by putting a coating over bacteria. And it's a way that we can still identify it, whether it's normal or abnormal, even if a bacteria is trying to evolve so we can't determine what it is. I mean, you know, like I said at the beginning, there's just so much that we could talk about. It's really fascinating, and we're only scratching the surface. Okay, so phagocytosis is pretty effective, but it's not going to be able to get everything, and that's why we may have to activate our third line of defense. But before we talk about the third line of defense, we've got 4 more things to talk about as part of our second line of defense. So remember, our second line of defense is like a toolbox where our body has 5 different mechanisms that can help. Number 1 mechanism was generic white blood cells that, like Pac-Man, perform phagocytosis to gobble up bad things. Well, a second example of something that our body can do in the second line of defense refers to these more specialized immune cells called natural killer cells. It's kind of a cool name, isn't it? Natural killer cells. Technically, these natural killer cells are a specialized type of lymphocyte. They're a large lymphocyte. They are found both in the blood and lymphatic fluid. You know, we just talked about the lymphatic system. In addition to being able to protect against bad things in the blood, we better be able to detect against bad things in the lymphatic vessels, which we rely on the lymph nodes for, but also we rely on these NK cells. I do want to make a point. Because these NK cells are part of our second line of defense, they're still considered to be non-specific, which means that it protects against anything. But here we get a little bit into some nuance. These NK cells, they attack mostly virus-infected and cancer cells. So in that way, they're not 100% non-specific. But these NK cells are still considered to be non-specific because they protect against many different viruses and cancers. So it's not like one individual NK cell is designed to defend against one specific virus. No. We have a host of NK cells, and they're able to protect against many different types of viruses and cancers. Okay. Let's talk about their mode of killing. So remember I said that for each defense, I'd like you to know a little bit about that defense, what type of cells make it up and where it works. But then also for each type of defense, I'd like you to know its mode of killing. So the NK cells do a really cool thing. And what I've done is I've tried to just give you the gist of it. Okay? So if you could just get the gist of it, imagine on our next lecture exam some matching or multiple choice, you know, which of the following correctly identifies the mechanism through which NK cells work. You'd pick the choice that was most similar to this. Here's how they work. These NK cells attach directly to the bad guy. So an NK cell notices, wait a minute, that's a bad cell. That NK cell will attach right to it. The Golgi apparatus of that NK cell will release a vesicle that then enters the target. That vesicle is able to enter the target cell, the bad cell, because the vesicle is specially designed to break through the plasma membrane of the bad guy. And once that vesicle is in the bad guy, it induces apoptosis of the bad guy. Apoptosis is programmed cell death. A more crude way of remembering that is suicide. So these NK cells are pretty tricky. They attach to the bad guy. The NK cells release a vesicle that go into the bad guy. They go into the virus-infected cell or cancer, and then they cause that virus-infected cell or cancer to kill itself through apoptosis. You're going to see a variety of mechanisms, and it has to be that way, right? We have so many different bad things trying to attack us, which evolve over time, which means that our defense has to be equally as complex. many different ways with which to try and kill any potential thing that might come in. I do want to go back for a moment because I did forget to mention this. These NK cells are often referred to as our surveillors. In other words, these are white blood cells that tend to hang out in the bloodstream and the lymphatic vessels. So it's kind of like the police. They're on patrol. When a policeman or woman, when a police person is on duty, they're on surveillance. They're driving around, they're on call. So as soon as something bad comes up, they attend to it. So we can think of our NK cells in much the same way. Some white blood cells we keep in storage until we need them, but not these. These NK cells circulate in our bloodstream, and in that way they perform surveillance, and then they pounce when needed. Really cool. Okay, so we had, as part of our second line of defense, we had general white blood cells that perform phagocytosis. Number 2 for second line of defense was the NK cells, these large lymphocytes that are circulating in our blood and lymphatic vessels that perform surveillance, and their mode of killing is to release a vesicle into the target that tells the target to perform apoptosis or to kill itself. Well, guess what? We don't just have white blood cells. We know the white blood cells are a part of our immune system. They're a big part of our immune system, but we have other types of cells that help. And here's an example of that. So a third tool we have in our body as part of our second line of defense are a series of antimicrobial proteins. We are going to talk about 2 types. We'll talk about antimicrobial proteins that make up interferons, and we'll talk about the antimicrobial proteins that make up the complement system. All right, interferons. Look, I've put in red what the most important things you should be reviewing. Really clear. Good. So these interferons are small proteins, but they're small proteins that are secreted by a white blood cell when that white blood cell has been taken over by a virus. This is cool, right? Yes. So sometimes a white blood cell is invaded and taken over by a virus. I mean, that's what viruses do, right? Viruses can only live if they take on a host cell. They invade one of our cells that we already have in our body. So what happens when a white blood cell, unfortunately, has been invaded by a virus? Well, most likely that infected white blood cell can't save themselves. But that infected white blood cell, before it dies, will release these specialized proteins to help other nearby cells to survive. Isn't that really cool? You can see some details here. Much like the NK cells, it's still considered nonspecific because it protects against white blood cells that have been invaded by many different types of viruses and cancers. But again, just be able to summarize. We don't have essay exams, so be able to pick from a choice what most closely resembles this mechanism of killing. So as I said before, we're going to have a white blood cell, and that white blood cell has been taken over by a virus. So that white blood cell that's been taken over by a virus is going to die. However, before it dies, that infected white blood cell will release interferons. Man, so cool. So before that white blood cell dies, it's going to release interferons. Those interferons will diffuse to nearby healthy cells. And those interferons will stimulate those nearby healthy cells to produce an antiviral protein. So that if that same virus now tries to take over that nearby healthy cell, well, now that nearby healthy cell has a specialized antiviral protein to protect it. And that was only able to happen because the already infected white blood cell released these interferons that told the healthy cells, hey, there's bad things around, you better produce this antiviral protein. Amazing. I mean, it really is amazing. And we're just scratching the surface. I am by no means an immune expert. Here is a visual representation, maybe if you like visual things. So, here we see cell 1. This is the white blood cell that's infected, right? The virus has come in, taken it over. So this cell on the left, it's going to die. But what that infected white blood cell does before it dies is it releases these orange triangles called interferons. And these interferons travel to nearby cells. So here's a nearby healthy white blood cell. So the infected white blood cell is going to die because it was taken over by a virus, but before it dies, it releases these specialized proteins called interferons, which will attach to a receptor, get into a nearby healthy white blood cell, and it will tell that nearby healthy white blood cell to produce an antiviral protein. So that if this same virus now says, haha, I'm going to try and take over this cell, it is blocked because the interferon has told this cell to make an antiviral protein that protects it. Really cool. Now, these interferons do other things. You don't have to know all of these things. I just wanted to include that because it's true. But also as an indication that, these modes of defense tend to help each other. So in that way, there is a bit of an additive effect where one tool within our immune system actually helps other ones. So as these interferons are doing their thing, they're going to activate more NK cells. They're going to activate more macrophages, which helps the modes of defense that we've just talked about. So they frequently help activate more of each other. All right, so this was our first example of an antimicrobial protein, the interferons. Well, another example of how our immune system has antimicrobial proteins is collectively something that we call the complement system. Get it? Complement. You look nice today. Okay, the complement system is a group of proteins. Cool. And overall, they get the name of the complement system because they complement or help the immune system do what it's already doing. Let me say that again. The complement system is a series of these specialized proteins. And what we're going to talk about in a minute, what they do is they complement or help the immune system do what it's already doing. So it's not so much that this is a whole new mode of killing, but these complement proteins, they complement what's already going on. They're going to make our white blood cells that are already active more active. They're going to help antibodies work better. So that's where they get this name, the complement system, a specialized group of proteins that complement the immune response. They help the immune system do more of what it's already doing. All right. Now, this gets a little complicated, but not to worry, my friends. Let's just keep it simple, okay? These complement proteins can work through one of two pathways. One of those pathways is considered to be classical, and the other pathway is considered to be an alternative pathway. We're going to keep it simple. The classical pathway of how these complement proteins work involves the use of antibodies. The alternative pathway for how these complement proteins work does not involve antibodies. The rest here is all extra. Let's keep it that simple. Okay, good. Good. Now, look at this nice fancy diagram. We're not going to be delving that deep, which you should be happy about. So what can we learn from this diagram? Well, we can already see what we talked about. We have two primary pathways. We're not going to worry about the lectin pathway, that's why it's crossed out. The classical pathway uses antibodies. The alternative pathway does not use antibodies. Okay, what else do I want to point out from this diagram? Well, I want to point out that you see a whole bunch of letters and numbers like C1, C3. Anytime you see that in this way, they are talking about complement proteins. So you can see I've defined that here. C1 is complement protein 1. C3b is complement protein 3b. So this system involves these specialized complement proteins, of which there are many. I'm only giving you an example of some of them. Look down here, complement protein 6, 7, 8. We have a bunch of complement proteins. They work together in a reaction cascade, which just means that we have one chemical reaction, and when that chemical reaction happens, it leads to a second chemical reaction, which then leads to this, which then leads to that. Like a dominoes, right? Like a set of dominoes. If one of these things doesn't happen, well then from there below doesn't happen either. It's like dominoes. If one domino doesn't fall over, then the rest of the dominoes aren't going to fall over. So how these complement proteins help the immune system do what it's already doing is through a complex series of chemical reactions that you do not need to know. Just know the basics. We have two pathways for how they work. The classical involves antibodies. The alternative does not. These systems involve many complement proteins that are labeled C1, C2, and so forth. These reactions involve a reaction cascade where one chemical reaction leads to another, which leads to another, which leads to another. Perfect. And lastly, what I want to point out is here at the bottom. When it's all said and done, after we go through this reaction cascade, when it's all said and done, these complement proteins will have helped the immune system do more of what it's already doing. The complement proteins will help to do more phagocytosis. The complement proteins will help to get rid of more of the break down products from phagocytosis, right? We said that through phagocytosis, the neutrophils and the macrophages gobble up the bad things, break them down inside the cell, and then spew out the remnants. Well, these complement proteins will help immune clearance. That will help us to clear out more of those spat out bad things. And actually, the next thing we're going to talk about, the fourth way that we can have our second line of defense, is through the inflammatory process. Well, guess what? The complement proteins can help do that also. Cool. You don't need to know cytolysis. I think you have enough to know. I already talked about that. These complement proteins at the end of the day help us do more phagocytosis, help us to get rid of bad debris, and help us better carry out the inflammatory process. Okay. All right, good. So I think what I'll do is we will get through the second line of defense in this first video, and then we'll save the rest for our second video. I don't like to end in the middle of a topic when possible. Okay, so here we are, second line of defense. We've already covered 3 different things that can make up our second line of defense. We had generic white blood cells that perform phagocytosis, number 1. Number 2, we had the NK cells, which are our surveillance cells, and they kill by releasing a vesicle that goes into the target, and the target tells that bad cell to kill itself, apoptosis. Thirdly, we have a series of antimicrobial proteins. Examples are the interferons. When we have a white blood cell that's been infected by a virus, and that white blood cell is going to die, but before it dies, it releases these specialized proteins called interferons, which go to nearby tissues and tell those nearby cells, hey, produce this antiviral protein, so that if that same virus tries to attack that healthy white blood cell, it now has the antiviral protein to protect it. And then our second example of an antimicrobial protein were proteins that make up the complement system, which we just talked about. That's a mouthful. Woo! Okay. Well, another way that we enact our second line of defense is when we have an inflammatory process. And, oftentimes we think of inflammation as bad, but really our body does it initially as a good thing. Here's a good example that you can see with your naked eye. We have an ankle sprain. That's some crazy discoloration there, crazy swelling or inflammation. Well, our body did that in the short term because it's bringing in supplies to heal the damaged tissue. When an area gets inflamed, it makes us less likely to put weight on it, which would cause further damage. So inflammation in the short term is a good thing. It's there for a reason. However, our body tends to go overboard, and you're probably familiar with the fact that we don't want to have long-term inflammation. So we do a lot to limit inflammation. So while it's good in the short term, we almost immediately want to limit it, okay? All right, so let's talk a little bit about inflammation. We know what the cardinal signs of inflammation are: pain, heat. If a tissue feels warm, there's more metabolic activity happening there, which is indicative that the body's trying to fight something. Edema is swelling in a soft tissue. By the way, effusion is swelling in a joint, but in this AMP2, we're more likely to talk about edema, which is swelling in a soft tissue. There are a host of chemicals involved in our inflammatory process. I wanted to give you 2 examples: histamine and prostaglandins. This should be leaky, shouldn't it? What was I thinking when I was, I mentioned, sniffing before, and wasn't sniffing Coke, I promise you. I really am not. Okay, there's many chemicals involved that cause inflammation, and there's also many chemicals that we utilize as an anti-inflammatory. Here's two examples of chemicals that have an inflammatory effect: histamine and prostaglandins. As a matter of fact, there's one that's an inflammatory chemical and one that is an anti-inflammatory chemical. Right. Histamine is an anti-inflammatory chemical. There needs an L in there. And prostaglandin is a chemical that is inflammatory. Okay. Just be able to give an example of each of these. A chemical that causes inflammation, prostaglandin, and a chemical that is an anti-inflammatory, histamine. I do want to talk about these basic steps of the immune response, the inflammation. And it might seem like, why are we talking about this in the immune system? Because in some ways, our inflammatory response, our tissue healing, like we talked about tissue healing in the blood clotting, right? But we have to talk about the inflammatory process with immunity, because I'll probably draw the same thing I drew in the blood chapter. When we have normal tissue that's been interrupted, well, we discussed this in the blood chapter because we used to have blood vessels going through. But once that tissue's been interrupted, now we're going to have blood leaking out. So we have to have a hemostasis response, not bleed out. But another side effect of having tissue damage is that we have an open space now for bacteria to come on in, right? Whereas this tissue used to be together, now this tissue has been damaged and bacteria wants to come on in. So we have to have an immune response associated with this. Simply because when we have tissue damage and inflammation, it just means that these foreign agents have another route to get in. So we need to protect against that. We're going to talk about the inflammatory process in terms of immunity in these 3 stages. The first thing, already talked about, my friends, right? We had tissue damage, and there's bleeding. Bleeding. So what do? We already know this. We vasoconstrict the blood vessels that are immediately surrounding the damaged area to prevent more blood loss. We vasodilate the outer blood vessels to be able to bring in supplies and remove bad things. Well, actually, I must be anatomically correct here. How can I sleep at night? Right, we have to have the outer blood vessels dilate to bring in good things and then to remove bad things. So the blood vessels that are right by it will constrict to prevent bleeding, further bleeding. The outer blood vessels will dilate to bring in supplies, including some of those chemicals. When this process is happening, the initial response, you can just see here, I made a point here. The permeability of our capillaries increases. This allows us to bring in more supplies. And this goes back to what was mentioned on a previous slide, a leaky tissue, which actually leads to more swelling, but initially it's to bring in more supplies. So initially, the capillary walls are more permeable than usual, right? So in this initial response to tissue damage, the capillary walls are more permeable than usual. The reason why is because it wants to allow us to bring in more supplies for healing. But one of the downsides is that it does lead to more swelling. Okay, what happens next? Well, next, so we have our tissue damage. We've tried to constrict nearby blood vessels, dilate further away blood vessels. So we've kind of mobilized our defenses or mobilized the area. Well, now we're going to bring in the white blood cells. So remember, the blood vessels further away dilated because we want to bring in supplies. And some of the supplies that come in are our general white blood cells. Why do those generalized white blood cells come in there? Because now that we have damaged tissue, bacteria are coming in and they want to get in. So we got to bring in some white blood cells as part of our second line of defense to try and protect against invasion. This is how white blood cells get into the tissue. Please review. These are some important terms in terms of our immune response, specifically with these generic white blood cells. We have leukocytosis. When we have damage to an area, we're going to have an increased number of white blood cells going to that area. So in that localized area, we have leukocytosis. Once those white blood cells arrive to the area, they adhere to the inner walls of the capillary. They marginate, they line up. And I have a picture on the next slide to show you. Then the white blood cells flatten and squeeze through the capillary walls, where they then travel to the site of injury. These all have special terms. Margination is when the white blood cells line up. Diapedesis is when the white blood cells are able to flatten and squeeze through the capillary wall. And then these white blood cells are attracted to the site of injury through chemicals, and that chemical attraction that brings the white blood cells to the damaged tissue is called chemotaxis. Once the white blood cells are there, they'll do their job through phagocytosis. Here's the picture, right? When we have damaged tissue, boom, we're going to have leukocytosis. The outer blood cells are dilating so we can bring in more supplies. We have an increase in white blood cells to the area, leukocytosis. Notice, what kind of blood cells are we seeing? Neutrophils, segmented nucleus, you know that. Well then, these white blood cells, these neutrophils, they marginate. They line up to prepare for moving. Then they squeeze through the capillary wall, and that process is called diapedesis. And these white blood cells are attracted to the injury site through these chemical attraction called chemotaxis. So cool. It really is. Here are some, this is the third and final phase. So we had our tissue damage. Our initial phase was kind of mobilization, where the nearby blood vessels constrict and the further away blood vessels dilate. So we can bring in white blood cells. Our second phase was called containment and destruction of pathogens. Our second phase is when these white blood cells arrive and then they move into the damaged tissue. And they move into the damaged tissue through a series of steps called leukocytosis, margination, diapedesis, and then they're chemically attracted to the area through chemotaxis. And now they can go in here and they can eat up the bad guys. Well, after we've kind of gotten rid of the bacteria, now we may have some other white blood cells come in. So the initial response was more through neutrophils, but now we also may activate monocytes. And then let's just leave it at this. And then we're going to rebuild new tissue. The first phase was mobilization, alter blood flow, bring in supplies. Our second phase was when these white blood cells came in to try and get rid of the bad guys. And only now, in the third phase of inflammation, can we actually begin to bring in more white blood cells, but now monocytes, to just finish the process of getting rid of bad guys. And then we can build new tissue to repair that damaged area. Whew, look at this. Some people are visual. This kind of makes me want to poke my eye out with a pencil. But if you're looking for a flow chart, here you go, my friends. And I've tried to circle or put a square in red and blue or green through each of these phases. But in no way do you need to know everything on here. Here's a nice review. Okay. This is what these phases look like, but you don't need to know this. Okay. Yeah. So the last thing before we end this first video, I know it's kind of long, but I wanted to get through all 5 things that can be included in our second line of defense. The last thing that may be included in our second line of defense is a fever. What we just talked about in terms of the inflammatory response, that is very localized, because that response is only going to happen where we have tissue damage. A fever is a systemic attempt to protect against a bad guy. So a fever, as you know, is when overall throughout the body, we purposely reset to an elevated core temperature. What's normal is 97.5 degrees Fahrenheit. Well, now, or about 37 degrees Celsius, in a fever, we purposely reset what's viewed as normal. And now we go up to 99 degrees Fahrenheit or 100 degrees Fahrenheit. This is a systemic attempt. It's an overall body attempt to boost our immune response. Here's why. When we have a slightly elevated core temperature, our interferons work better. When we have a slightly elevated temperature, our metabolic rate goes up, which means we can form and do tissue repair better and faster. And we know that at a slightly elevated temperature, the ability for bacteria and viruses to reproduce goes down. All right, so this is absolutely part of our immune response. Whereas other things in our toolbox for a second line of defense is more localized, a fever is systemic. Our entire body temperature goes up a little bit. And within limits, when we increase our core temperature slightly, this is helpful to our immune system. Makes interferons work better. It boosts our metabolic rate so we can repair tissue better, and it reduces the ability of bacteria and viruses to reproduce. However, of course, if we increase our core temperature too much, that can be a bad thing. This is why we don't want a high fever, because at too high of a temperature, our enzymes will denature, they'll unravel. Our proteins, such as the complement proteins, the interferons, our proteins will denature. So at too high of a temperature, when our proteins denature, it actually impedes our immune system. But within limits, a fever is very beneficial for the reasons we have stated. Okay, you don't need to know these specific steps. They're just on here if you want to see. Okay, I'm going to end there, and we'll pick this up in the second video.